We also assist researchers with new data collection. So sometimes someone will come to us and say, you know, I think my survey is so important on a national level that I don't just want your help finding a few people to do it, I want it to become part of IAN. For example, Dr. Janet Farmer at the University of Missouri recently collaborated with us to develop a access to healthcare survey for kids on the spectrum. And that became part of what I call real IAN, you know, the core part of IAN. One of the important topics that we're looking at in IAN is treatments. Families can report on every treatment they're using, from ABA to social skills groups, from medications to special diets, and anything in between. There's like a drop-down list of over 300 treatments that families can choose from, and they can tell us about each treatment they're using. They can also add something. So if, for example, there's something we haven't heard of yet, or we overlooked, or something new, the family doesn't have to be boxed in and not get to tell us about it. They can add it, and then we will know about it. One thing that's wonderful about this giant collection of treatment data is it's helping researchers prioritize, like what are the treatments that most urgently need to be studied, because we actually have numbers about what's being used by how many people, and if a treatment that's in widespread use doesn't have that much evidence supported, or it's contradictory, or there's no consensus yet, then it helps to set the priority that that's one of the ones that needs to be studied very, very quickly. I would say special diets probably falls in that category, and indeed right now the National Institutes of Mental Health is doing a clinical trial on the gluten-free, casein-free diet, just exactly for that reason. Another thing about the treatment data is you don't tell us about it just once. You're able to come back and tell us that it was great, or that you stopped it. Did you stop it because of bad side effects, or because it worked so well you didn't need it, or because it was just useless? But it's very important not to just get that one report, but to get reports over time. Because with treatments, you know, it can be something works and then stopped working. It's just like with a car. If you went and polled people with a new Hyundai and a new Ford and a new Lexus, they'd all love them the first week. But if you ask them all 3 years later, you get a whole different kind of information about what their experience was. And as I said, because we're always giving back information, we create preliminary reports on the treatment data to share back with families. And I'll talk some more about how that is presented. Another special topic is grandparents that we just recently addressed. We're very excited about. What happened is when IAN first began in April of 2007, we started to get phone calls and emails from grandparents. And they were telling us, now wait a minute, only parents of children with ASDs can participate in your study. That's not fair. And by the way, I spend a lot of time with this child. I know all about the impact on my adult child. I know all about the impact on the siblings and on myself and on this whole family's functioning. And why aren't you asking me? And we decided they were absolutely right about that and began to develop a grandparent of a child with ASD survey. Bonnie Gilman generously helped us to refine that, and then we were able to go on and pilot test it with 40 volunteer grandparents. And finally, just in October, we were able to launch that. We had over 2,600 grandparents answer with just in the space of a few weeks, so we're very delighted. And indeed, Paul's going to give you some more details on some preliminary findings from the grandparent survey. And in addition, AARP is actually, from what we hear, going to be running a story on it Monday on their website, so you might want to take a look for that. Okay, well, clearly we hope that IAN Research will be able to make giant contributions as we go forward, and some of the things we're hoping to do is to continue to focus on children and their families, but to also include adults on a national level. We've just begun because we've created adult surveys, but one of our challenges now is to find a strategy to reach out to adults all across the spectrum, from a very high functioning adults with their own families all the way to guardians of adults that are under kind of extensive caregiving arrangements and everybody in between. And it's quite a challenge because those families aren't really in the same place as the families of little kids are. Whereas you can go to an autism walk and find parents of children, it's not quite that way for adults, and we're still trying to develop that strategy because we definitely want them. And there's researchers standing in line for them, actually, hoping to have their participation. We also want to increase participation overall. We hope you'll spread the word about Ian and help us do that, with special emphasis on including people that have been a bit underrepresented in Ian to this point, including minority groups and certain parts of the country that don't have as much participation. We hope to boost California's participation after today. There's also an international expansion, just as grandparents contacted us when Ian launched. We also were hearing from Canada and the UK and Australia and even places like Nepal. Families were contacting us and saying, well, why can't I do it too? And we're trying to overcome some of the barriers to being able to do this entire project on an international scale and hope to slowly expand into other countries. Something that we actually didn't foresee when we began with Ian is how much it could actually be a powerful tool for policy-related data. We're focused on science and treatments and all of these things. However, the same mechanism, the same information coming from families really has the potential to be used for policy-related issues. And we think that'll be even more true for adults. We know next to nothing about adults with ASD in the United States. And through Ian, we could find out what kind of benefits they're getting, where they're living, how they're doing in the workplace, how many have tried to work and failed, how many have succeeded, what's working for them, just a variety of questions. As I mentioned earlier, the National Institutes of Health is now funding Ian in part, and that's because they have a project called the National Database for Autism Research. So another way we're expanding is by partnering with them. They had a vision similar to ours in a way, to create a giant pool where all the researchers using NIH funding for autism research would put their research in a big, gigantic pool that many could access. It's a similar vision. And then they looked over and noticed we already had 30,000 people. So what we're hoping to do is partner with them to make our data, ask our families the permission to join NDAR. Not all of them will, but some of them will. And that'll kind of get NDAR going. It'll make even more gigantic data sets with more massive sample sizes that are more meaningful for research. And it also will allow researchers to look at information about a single person across many studies. For example, my son Jerry that you saw has been in a genetics study, he's been in Ian, he's been in a MRI study, and he's been in a motor skills study. Well, if all of those studies were taking part in NDAR, a researcher could come along and say, I want to look at this MRI, and I want to know about all this developmental history that's in Ian, and be able to look at all of it together. So it's going to be a wonderful acceleration of research, has the potential to do that, certainly. Well, now we're going to go orange, which means into Ian Community, which looks like that. And this is the website where we communicate back with the rest of the world. And you remember communicating back with families and hearing from families is really core to Ian. And so we can't just have our research site where you enter your questionnaires. We need a place to give back, and that's what Ian Community is. So it's a research-focused website. It is open to all. It is not just open to families participating or adults participating in the research portion. It's for the whole world, so it's not restricted to the United States. It's for grandparents, it's for teachers, and it's for everyone who's involved in the autism community. Some of the material that we have on there that I hope very much you will use is some wonderful basic information about ASDs. So if you're ever in the situation, and it comes up a lot for people, I think, where you're trying to educate a new teacher, an aide, a scout leader, someone at church, neighbor, we have some wonderful materials that can be linked to about ASDs, for example, is a real wonderful basic information about the spectrum and what they look like across the spectrum. Same with challenging behaviors. Now, the focus of the site is not just to give back information, but to kind of help the families become better and better and more critical consumers of autism research. We really want them to be our partners, and to be our partners, they have to be able to tell us they don't like what we're doing, and we like them also to be able to be critical of anybody's research, to kind of get to the point where they feel comfortable and empowered to say, you know, I don't really agree with that. The way you did this isn't valid, or to not feel like they're just the passive recipients of research that comes out. The website's a unique place to find out what 11,000 families are saying about autism, and the way we do that is through our research reports. You know, to get a scientific paper published takes a long, long time. It can take years. At the same time, it's not often in a language that's friendly to families, so it may not feel that useful to them anyway by the time it gets into that format. So what we do is we take our preliminary findings and we put it in a family-friendly format, and we share it back far sooner than it would ever be shared in a paper, and put it on our website. Also wanted to let you know we have an Ian Community e-newsletter. If you join Ian Community on our website and sign up for the e-newsletter, you get kind of informed about every 8 weeks or so of the latest research reports and articles that we have there. And that way you can read about what are we learning about treatments. You know, we have a treatment report about special diets. We have one about medications. We have reports on family stress, reports on regression, and all kinds of topics. And it's actually based on the data families are sharing. And if you become a part of Ian, you know that your numbers are in there, in those pie charts. Again, our goal is to have people participate. Another wonderful tool for those of you who like to explore the stats and the numbers is our entire statistics program. We have it arranged in this wonderful transparent way where the data flowing into Ian and changing by the hour as new people sign up and answer the surveys is flowing right into a giant state statistics package where they can go and see the pie charts that compare your state to other states on key autism measure. Actually, not to other states, but to the nation. So you can see how California compares to the nation and how long it's taking to get a child diagnosed, for example. You can also look at any question in the Ian surveys and see what the response has been so far. And people interested in research, like if there's some graduate students or anyone who wants to look even deeper, can go into our online code books and actually see the question, all the possible responses, and how people answered. So it's a wonderful tool. Okay, and I'm going to finish now and let Dr. Donnelly bring up Paul to share with you some of the findings coming out of the Ian project. Thanks.